Hello, ladies and gentlemen. I'm Susan Diana Kerfua from the Nelson Mandela African Institution of Science and Technology, but I also work for the National Livestock Resources Research Institute, that's in Uganda. What I want to share with you is on my research that is entitled Retrospective Foot and Mouth Disease Outbreak Reports from Uganda and Tanzania Border Districts. That is from the years of 2011 and 2016, looking at the implications for foot and mouth disease control by vaccination. This slide just shows a list of the members that were involved in this research, many of them from Tanzania and from Uganda, and also we had some colleagues from the United Kingdom, that is the University of Glasgow. So to start with, for an introduction, foot and mouth disease is endemic in both Uganda and Tanzania, and there's been outbreaks that have been reported at least annually, according to the ministries that are in charge of agriculture and livestock. What's interesting about this disease is that it has a very low mortality but a very high morbidity. Therefore, countries that are affected by this disease have a lot of losses, especially economic losses. The economic consequences are very high. According to a study that was carried out by Baluka in Uganda in 2 districts, she showed that a farmer loses about 123 United States dollars per year per head of cattle when there is an outbreak on their farm. And this is quite high. We know of also other outbreaks that have occurred worldwide that have led to high economic consequences. But also these countries that are endemic, like Uganda and Tanzania, spend a lot on control and actually miss out also on revenues, that is in terms of world trade. They cannot trade some of their livestock products or their livestock on the world markets. So this is quite terrible for the countries that usually suffer foot and mouth disease outbreaks. So it's not only the countries that suffer the consequences of the outbreak, but also farmers, individual farmers. And in Africa, we have resource poor farmers, smallholder farmers, and a farmer losing about 123 United States dollars per year per head of cattle. That is quite a lot of money. And also the people along the value chain, the livestock value chain. We're looking at people who sell milk, people who sell beef or meat. We're looking at even herdsmen. These are some of the people who get to lose out on income when there are foot and mouth disease outbreaks. So we're asking ourselves that what is the actual problem here? The progressive control pathway was recently introduced in Eastern Africa, and we know the stages of this pathway, and Uganda and Tanzania in the initial stages of this pathway. The initial stages of this pathway are very important. To the stages 0 and 1 are very important in getting countries or regions to the status of free without vaccination. And the initial stages involve basically identifying risk points and also developing strategies that would be implemented in those risk points. The problem we have right now is that we have limited information on foot and mouth disease, especially in these border areas. For example, this particular border that I'm working on, according to Dinado 2011, he showed that this border area between Uganda and Tanzania is one of the main risk areas of foot and mouth disease circulation in Eastern Africa. But then we still have very little information, limited information on foot and mouth epidemiology in this area. So as an objective of this study, we sought out to ascertain the spatial and temporal distribution of foot and mouth disease outbreaks in districts that are located in this border area between Uganda and Tanzania. Recently, commissary reports have shown that there's a lot of trade that is happening along these routes. Animals are actually transported right from Tanzania through this border and taken to Nimule in Sudan. And along that path, there's a lot of trade. Along that border area, there's a lot of trade that's happening. So we believe that this border area is very important and foot and mouth disease epidemiology studies should be carried out. So this is the study area that we are talking about, that is over here. The different colors are just showing the different districts. The blue is Isingiro district in Uganda. The pink is Rakai district that is found also in Uganda. Then when we go below the purple, the light purple, that is Misenyi district found in Tanzania. and then we have the red, that is Chera district, that's also found in Tanzania. So these 4 districts make up this area, this border area. And we just want to find out what is the foot and mouth disease epidemiology in this particular area. So what we sought out to do was we collected retrospective data. This was compiled from both the Ugandan side and the Tanzanian side, looking at these 4 districts. For the Ugandan side, we got information from the National Animal Disease Diagnostics and Epidemiology Center, that is part of the Ministry of Agriculture, Animal Industries and Livestock. So we got information from this center, and also we got information from the district veterinary officers from their reports, and this information was entered into Excel. And then we analyzed the information using R. Rather, we analyzed the data using R, using generalized linear mixed effect models. And we had the response variable as being the number of outbreaks that particular district or that particular ward or sub-county had. And then we had the fixed and also explanatory variables being the seasons, the border, whether they are close to the border or not. And also we looked at also individual sub-counties if they were also a factor in this. So maps were drawn using QGIS, and also this is just for someone to note that words are synonymous. Words in Tanzania are synonymous to sub-counties in Uganda. So for the results, what actually we got was that about 60% of the data that we looked at lacked information on serotypes that were responsible for outbreaks. And we believe this is quite important when we're looking at vaccination, the sustainability of vaccination. If we lack information on serotypes that are circulating in that area, then it will be very difficult for us to know the intervention, the specific serotype intervention to put up in that area. Of course, the background is that foot and mouth disease has these 7 serotypes of the virus, and vaccination has to be specific. If it's serotype O that's circulating, then you have to vaccinate using serotype O, the vaccine strain from serotype O. So it is so specific that such information on the serotype that's responsible for an outbreak is very pertinent when it comes to intervention. So when such information is lacking, then that raises a red flag, and then we ask ourselves, okay, is the vaccination program or the vaccination intervention sustainable? The data also lacked information on geographical positioning systems, and also on the number of there was some information missing in some districts on the number of animals at risk. So basically, most of the data that was collected was not really holistic. And also what we found out was that most of the diagnosis was based on clinical signs, and there was no laboratory diagnosis for most of the outbreaks that occurred. And then we note that actually major decisions are actually taken based on these reports that are based on just clinical signs. So the data was not holistic, because we expected something like the serotypes that were responsible, or that would have been gotten from lab diagnosis, but this was not the case. Then we also found that 46% of the 82 reported outbreaks occurred in sub-counties or wards that were closer to the border. Of course, also this has implications, because if we're going to look at a sustainable vaccination program, then we have to know where we need to put the thrust in resources, because it would not make a lot of sense if you just went out and vaccinated anywhere and anytime. So it's very important, like I said before in the introduction, it's important to identify the hotspots. When we identify the hotspots, then we can have something sustainable. We can zero down on trying to intervene or to control the disease in these particular areas that are hotspots. So that was very important. We thought that was very important information. And then also 21% of the outbreaks were reported in areas that were adjacent to wildlife. I will be explaining this a little later, following the next slide. And then definitely the number of outbreaks increased with time, per year. As the years went on, the number of outbreaks increased. We shall be seeing this also shortly. And then one thing that also stood out from this work was that in some villages and in some wards or sub-counties, outbreaks were reported successively over the years in certain particular villages and sub-counties. So this raises questions like, could these places be having certain features that predispose them to foot and mouth disease outbreaks? Say, could they be having certain markets? Yes, for example, the sub-county of Ndinzi in Isingiro district in Uganda and the sub-county of Bubale in Bubale ward, that is in Tanzania, had successive outbreaks throughout the years. And actually, when we went out, when we screened further, we found out that there were major cattle markets in these sub-counties and wards. So these are some of the factors that should be teased out if we're going to look at controlling foot and mouth disease, or even getting rid of foot and mouth disease in these endemic areas. So we need to zero down on what is actually causing this. So we thought maybe markets, maybe we need to look at border areas. Like I said before, most of the outbreaks actually were significantly occurred around the border areas. We also need to look at things like cattle routes. Where do the cattle usually pass? What happens along those routes? And also wildlife, like I hinted before. 21% of the outbreaks were reported in areas adjacent to the wildlife. Another finding that we came up with was that most of the serotypes that were present between 2011 and 2016 were Southern African Territory 1 and 2 and serotype O. Now, it's interesting to note that this information on serotypes present in these areas between this time was actually gotten from research work and not from surveillances or maybe analysis of the outbreak samples. So it's very important to note that that lack of diagnosis, that linkage, linking the field with the lab, is still missing in these countries. So this slide basically shows the spatial trend of the outbreaks. You can see it's through the years of 2011 and 2016. The red lines denote the border areas. The above is Uganda, while below is Tanzania. And we can actually see that most of the outbreaks cluster around the red line, which is the border area. We can see the clustering of the outbreaks that were reported along this area. In Tanzania, 59 outbreaks were reported within this time period, whereas in Uganda, there were about 23 outbreaks that were reported. But then we also know that foot and mouth disease outbreaks, farmers do not usually report. Some farmers do not usually report outbreaks. And this was also reported by Sutmola, who said that sometimes there's certain stigma that is attributed to foot and mouth disease outbreak on a particular farm. So sometimes farmers, or even sometimes it's for political reasons, economic reasons, that farmers do not actually report that an outbreak has occurred on their farm. So even these figures that are being presented on this slide may even be realistic in the real setting, could be even much higher than what is reported here, just because in some cases the outbreaks are not recorded. So we can, just to let you know on this, you can see that as the years proceed, more outbreaks keep on happening. But also I'd like to point out the areas that are close to the game parks. The game parks are in green, the light green color. You can see Lake Mburo up there in Uganda. There are not so many outbreaks that are reported around that area. And also when you look at the game reserves that are in Tanzania, yes, some wards or some counties or sub-counties actually report successively. If you look at 2013 through to 2016, yeah, the wards that are a bit close reported outbreaks. But we do not know if actually the wildlife is playing a major role, especially in East Africa. This also follows a study by Casey Byers, who showed that wildlife was not very important in the foot and mouth disease epidemiology in Tanzania. So these are some of the areas that I think the foot and mouth disease community can tease out, and we can do some more research on some of these findings. When we looked at the temperature trends, we actually found that about 70% of the outbreaks occurred during the dry months, compared to about 30% of the outbreaks that occurred during the wet months. Now, many studies have been carried out and have actually shown that yes, this is true. More outbreaks occur during the dry season than during the wet season, possibly because farmers have to move their animals long distances looking for pastures and looking for water. So in that whole process, animals get to converge in places, in drinking places, in pastoral lands. They converge, and then foot and mouth disease being a very contagious disease, before you know it, just one spark and there is an outbreak. So during the dry seasons, there are more outbreaks reported. Also, I think because about that time, the animals do not have a very strong immunity. I mean, they've gone for days maybe without food, and they've walked long distances. So there's some kind of immunosuppression. So this could also predispose them to outbreaks. So showing these temporal trends is also important if we're going to look at the sustainability of vaccination. When are the right times for us to vaccinate, to do preventive vaccination? When are the right times for us to do that? Yes, we would have to put a lot of thrust in looking at the dry seasons compared to maybe looking at the wet seasons. So this information that is derived from this research guides the countries, guides the regions into knowing where to put our resources if we're going to look at a sustainable vaccination system. Just to conclude and throw in some recommendations, yes, we found out that there were more reports of foot and mouth disease outbreaks in Tanzania compared to Uganda. And of course, we could have so many different reasons for this. Maybe the Tanzanians report better, the farmers report better than the Ugandan farmers, or maybe there are actually more outbreaks in Tanzania than Uganda. I don't know. So so these are some of the questions that we need to come to discuss. These are some of the things that we need to discuss amongst each other. Could it be because of the different livestock disease control policies? For example, if you look at my fourth point, where we were talking about having more collaborative efforts to combat transboundary foot and mouth disease, we need to have similar livestock disease policies. But as for now, we see that Tanzania and Uganda have different livestock disease control policies, especially in regard to foot and mouth disease. Whereas in Tanzania, foot and mouth disease is not a public good. The farmer has to pay about 1.2 United States dollars to have his animal vaccinated. Whereas in Uganda, a farmer pays about 0.3 United States dollars to have, that's about 30 cents, to have his animals vaccinated. So these discrepancies in control policies can be a bit difficult if we're going to have some kind of collaboration. So sometimes we may need to have similar livestock disease control policies if we're to control the disease regionally, if we're going to control the disease as neighbors, joint efforts. So the next recommendation was that reporting systems need improvement, and we need more holistic data to be reported. What we mean by this is that let's have yes, the clinical diagnosis, but also let's have it complemented with the laboratory diagnosis for us to know actually what vaccines we're going to go out there and use, because if we just do clinical diagnosis, we're not going to know what to actually do. We're not going to know what vaccines we're going to use in that particular area to curb down the disease. So the reporting systems need to be improved. We need to have some of this metadata, like the geographical positioning systems. We need to have metadata like the animals at risk. We need to have metadata that can help us to improve on interventions that we may be planning, so that these interventions can be strategic and can help us in the long run. Then, like I hinted before, most samples were not analyzed in order to determine the vaccine serotype to be used in case of having an intervention. which I think is very important. It's a very important point. Like I said, if we're looking at the sustainability of vaccination as an intervention for foot and mouth disease control, it's very important for us to know which serotypes are circulating, and to know, like I also said, like to know which areas to put our thrust in. So these are just some of the conclusions and recommendations that came of our study. I would like to thank the Bill and Melinda Gates Foundation for sponsoring this study, for funding this study through the program for enhancing health and productivity in livestock that is based at the Nelson Mandela African Institution of Science and Technology. And thank you for your attention.